This is Group 3, Trigger 1, Evidence-Based Practice Presentation by Anna Harkin, Anna Herrig, Christina Moore, Hannah Netter, and Elise Weir. Spencer Brown, 2018, characterized dysarthria as a group of neurological motor speech disorders that show abnormalities in respiration, phonation, articulation, resonance, or prosody. Assessments like diadochokinetic rates, screenings of respiratory phonatory function, perceptual evaluations, rating forms, intelligibility, and speaking rates can help determine if the patient has dysarthria and what type. Flaccid dysarthria is characterized as damage to the cranial and/or spinal nerves and has signs like hypernasality, breathiness, nasal emission, audible inspiration in short phrases, weakness, reduced range of motion, slow rate but intact rhythm, fasciculations, atrophy, hypotonia, diminished reflexes, and flaccid paralysis.
Stated by the American Speech Language Hearing Association, flaccid dysarthria is caused by damage to the lower motor neurons of the peripheral nervous system. Picoya 2024 highlights damage to cranial nerve 10 vagus, naming the recurrent laryngeal branch specifically, which can contribute to flat and imprecise speech as it helps control the vocal folds. Thomas 2022 notes that damage to cranial nerve 9, glossopharyngeal, can also lead to imprecise speech as cranial nerve 9 innervates the muscles that elevate the larynx and the pharynx.
Shulman Green et al. 2020 identified 3 key ways that caregivers can be counseled to support patients. The first is being educated on patients' needs and diagnoses, which can give caregivers a better understanding of what their role is and keep them from overstepping boundaries. The second is utilizing resources to help oneself as the caregiver. It's important to remember that caregivers may be overwhelmed with these new complex needs and diagnoses, and it is helpful for them to be referred towards a number of social, emotional, and physical resources. And the last is supporting the patient in learning to live with this new diagnosis. It's important for caregivers to step into a supportive role for the patient and help them to cope with this new diagnosis.
Park et al. 2016 described an intensive treatment to improve speech clarity in adults with dysarthria. 8 participants, 6 with TBI, 2 with stroke, attended 1-hour sessions 4 times a week for 4 weeks, with daily homework for carryover. The program included 3 phases: pre-practice, where the clinician modeled clear speech and provided simple feedback; intensive practice, involving repeated practice of functional phrases and speech tasks; and homework, where participants used clear speech in daily activities. The treatment emphasized frequent practice, functional communication, and consistent feedback to increase intelligibility.
A study done by Portolete et al. 2019 examined the treatment effect of a hierarchical motor speech treatment approach for a 45-year-old male with flaccid dysarthria caused by a stroke. They targeted respiration, resonance, prosody, phonation, and articulation. The focus was on compensation and maximizing existing function. Strength training was avoided. Treatment techniques included diaphragmatic breathing and postural support for respiration, over-articulation and vowel-only reading to improve resonance control, emotional prosody tasks and rate and emphasis patterning for prosody, yawn, sigh, and exercises for improved respiratory laryngeal coordination and loudness for phonation, mobility drills with compensatory placement cues for articulation. Results of these techniques were improved respiratory support and reduced hypernasality, increased speech intelligibility, enhanced vocal stability and prosody, and improved self-perceived communication and quality of life. And here are references.